I think what's really amazing, and especially with joint replacements and particularly the hip replacement, is I can have someone that has come to the office with the inability to walk because of pain, because maybe their joint has no movement, and after I do a hip replacement, they can walk into the office and basically tell me that I've changed their life. And it's not so much me, but it's just the ability to restore function to some destroyed joints. I've been in orthopedic practice for approximately 25 years, and I've been doing anterior hip replacements for approximately the past 10 years. This is an appearance of a hip joint during the anterior approach. Basically, we have muscles that are being spread apart as opposed to cutting and repairing. So these are metal retractors that allow exposure by retracting the muscles away from the hip joint itself, and the procedure can be done again without cutting and repairing muscles, so that when we're done with the hip replacement, the muscles fall back together and it's easier for someone's recovery. 10 years ago, I realized that that type of approach for a hip replacement would be the best procedure for a patient's recovery. And so I went and underwent special training at different facilities to do that procedure. The hip can be approached from the front, which is anterior, from the side, which is lateral, or from the back, which is posterior. From the front, we can go between muscles. If we go the other approaches, we have to cut and then repair muscles, which makes the recovery a little bit more difficult for the patient. The vast majority of surgical approaches for hip replacement were posterior across the United States for many years, and then as surgical techniques improved, extra surgery training was required to be able to do the anterior approach. Sometimes even special equipment is utilized, such as what's known as a HANA table, which is available at Carson Valley Medical Center, which allows us to do that procedure efficiently.